Friends, my name is Dr. Nagaraj Desai. I'm a cardiologist and adjunct faculty of JSS University of Medical Education and Higher Research in Mysore. I practice out of Bangalore city. Today, my task is to kind of discuss with you regarding the correct way of measuring the blood pressure at home by any one of us. I'm sure you are already interested in taking your blood pressures at home, and I want to make sure you record it correctly and proficiently, and as a professional, in fact. First of all, before you start recording the blood pressure, make sure that you empty the urinary bladder. Having full bladder adds to the number that you get out of the blood pressure readings. Not kind of invited, isn't it? When once you are comfortable to sit down in a chair, normally we record the blood pressure in a sitting position. Make sure that your back is erect and it is supported with the back of the chair, and your legs are uncrossed and comfortably, kind of they're on the floor. And importantly, the upper arm is bare. There is no shirt or bunion or anything that is rather kind of obstructing for tying of this PP cuff. When you are about to start the PP cuff, tying up, make sure it is of correct size. Smaller the BP size, it may add to the numbers of the BP readings as much as something like 5 to 10 millimeters. Indeed, when the BP is being recorded, make sure that you do not talk with anybody. In case you are recording the blood pressure on your own, it is advisable to use your left arm to record the blood pressure, simply because it is more convenient and you can place your cuff much more easily. The lower edge of the cuff is above the elbow crease by at least about 1 centimeter. Make sure the fingertip can be insinuated between the cuff and the skin. After getting ready with all these things, you make sure that you are comfortable, relaxed, and you do not talk in between. I'm sure when you use a BP measuring instrument, it is of good quality and it is calibrated, and many companies are marketing now these products. You can choose whatever kind of is comfortable to you. Now, after you relax for a few seconds, then you can hit the start button. Many instruments have the display that it is ready to record the blood pressure. Many instruments have some kind of audio signal to say that the instrument is ready for recording. Once you start the button, make sure the elbow is at the shoulder level. Fortunately for us, many a time, when we keep our elbows on the table of a standard height, it seems to be at a higher level, at the same level as the heart in an average, height personality. It is important because if you take it at a higher level, the blood pressures may be misrepresented by the machine. Now, as the cuff is inflating your arm, the pressure in the cuff, pressure in the bladder of the cuff seems to kind of constrict you, and do not get panicked or do not get stressed about it. In fact, having stress during the measurement of the blood pressure itself adds to the number, and it can falsify our blood pressure recording. So once the cuff blood pressure or cuff bladder pressure increases beyond certain levels, it stops for a few moments and it starts deflating in a very systematic manner. Unlike a mercury manometer, these digital instruments are designed to reduce the cuff pressure in a very systematic and a very, very regulated manner, wherein about 4 to 5 millimeter blood pressure is reduced. Now, there are some signals which may suggest that it could be a systolic blood pressure, but let's not bother about the details of it. But suffice to say here that there may be some kind of a signal coming out of the machine saying that the quality of the recording is good. And if it is not good, you may have to repeat it. So the higher reading is called a systolic blood pressure, and a lower reading is called the diastolic blood pressure. Many instruments will have yet another reading called the pulse rate or a heart rate. So these three readings have to be recorded. In case somebody has to answer a question, what is his blood pressure? If it is something like a 120 higher value, 80 lower value, it is 120 systolic and 80 millimeter diastolic. And the pulse rate may be something like 70 or 72 or maybe 74. Mind you, the blood pressure readings need not be always the same. That's one of the reasons why people get confused and worry about the quality of the instrument itself, and they get kind of frustrated with it. First reading, if it is higher, record a second reading. After about something like, I generally advise the people to wait for about half a minute to 1 minute and re-record it. The same steps of relaxing, not talking, and making sure that the cuff is in position, and making sure that we have uncrossed the legs, making sure that your back is resting against the back of the chair, and recording is done at the heart level while you're breathing quietly. So the second reading, it is slightly lesser than the first reading. This is something to do with the stress associated with the blood pressure recording procedure itself. In case the second reading is higher than the first reading, I would advise my patients to record the third reading. Generally, the second and third reading match by about the same or maybe 1 or 2 millimeter this way or that way. In other words, one may have to take the 3 readings if the first reading is higher and second and third reading happen to be almost the same, and one tends to average the 2 recordings of the 3 and then report it as the blood pressure measured in a person. It is not enough to record the blood pressure, say, once in a way. That's not how the home blood pressure monitoring is done. It should be done at least about 4 times a day, once in the morning as one gets up in the morning, and at another time in the evening before one retires to bed, preferably before taking the medicines. It will give us an idea about how the blood pressure is right in the morning, and also how the blood pressure is as one is retiring to the bed. Whole of this procedure should take not more than about something like 5 to 7 minutes in the morning and 5 to 7 minutes in the evening, when once you systematically get into the habit of recording the blood pressure. I'm sure, you understand why JB Chemicals and Pharmaceuticals wanted us to record this video for you to make sure that the blood pressure needs to be correct, needs to be controlled, and it has to be right for all of us. Only by right blood pressure reading, there could be right decisions and right treatment for all the people who are interested in controlling their blood pressure to the optimum level. Because many a time when we record the blood pressure in our offices, they may be higher. This could be called white coat effect. And many of you would know about it. By recording the blood pressure at home, you can definitely help yourself and help the doctor to monitor your blood pressure on a long term. I wish you all the best and keep the blood pressure under control to help yourself better. Thank you so much for your kind attention.